served Amara Saloon for a very long time. He was appointed on the 15th of November 2024 by His Excellency President Julius Maada Bio as the Ambassador Extraordinary and Plenipotentiary of the Republic of Sierra Leone to the United States of America, with concurrent accreditation to Brazil, Canada, and the Commonwealth of the Bahamas, Cooperative Republic of Guyana, Jamaica, the Plurinational State of Bolivia, Republic of Chile, and Republic of Trinidad and Tobago. You'll get this. This man has served the country for a very long time. I think we need to have a applause. He has also served as the Deputy Permanent Representative for the Political Affairs in the Permanent Mission of the Republic of Sierra Leone to the United Nations from November 2022 to November 2024. Excellency Sowa was also the alternate permanent representative on the Security Council. He specifically handled files relating to the Americans, Eastern Europe, women, peace and security, education, food security, and climate change. In the United Nations General Assembly, his responsibilities covered all issues relating to the second, third, and fourth committees in the United Nations, which included, but were not limited to, the Peace Building Commission, the Financing for Development, ECOSOC, Commission of Social Development, Commission on the Status of Women, C24, G77+, and etc. Ambassador Sowa also followed up on issues related to Transforming Education Summit and the Summit of the Future. Before the above appointment, Ambassador Sowa served as the National Program Coordinator of the government's flagship program, the Free Quality School Education Program, 2018 to 2022, where he led in the design and implementation of the program, succeeding in laying a solid foundation for the transformation of the education system in Sierra Leone. We hope this will continue because he started this a long time ago. Ambassador Sowa also worked in the decentralization of secretary in the Ministry of Local Government and Rural Development, serving as a regional coordinator between 2005 to 2012, and resident technician facilitator from 2015 to 2018, where he contributed to the successful implementation of the World Bank funded institutional reform and capacity building projects. He also has considerable experience working with NGOs, maybe we can use it, having led project teams at Plan International and Leone Cheshire Disability. He has also been a high school teacher, university lecturer, and administrator. Ambassador Amara Sowa holds a bachelor degree with honors in English, 1991, and a master's degree in development, 2010, from Fabric College, University of Sierra Leone, and Jala University, Sierra Leone, respectively. He's married with 3 children. He loves reading, traveling, and watching soccer. Please join me in welcoming him tonight. Thank you.
Evening.
MC, this is marginalization and discrimination. Which an ambassador doesn't dance? Mr. DJ, I hold that against you. Yeah, it's okay, it's okay. Thank you very much, Bridget Ahmed Vario, for that introduction. You know, Bridget has been my primary point of contact with Healthcare Sierra Leone, and she has chaperoned me right from the day I was contacted to serve as keynote speaker right on to when I arrived yesterday, when she and Finda went to the airport to pick me up. Thank you for that introduction. Chairman, thank you for the privilege to serve as keynote speaker at this very, very important occasion. The chairperson, esteemed members of Healthcare Sierra Leone, USA, honored guests, friends of Sierra Leone, ladies and gentlemen, good evening. Good evening.
Good evening.
Uh, Please allow me to recognize two very special people. These people were really poised to attend another function tonight. But then they saw me on the flyer and they decided to divert their purpose for this evening to come here just to see me. Dr. Ibrahim and Mrs. Amina Sabah, thank you for coming to see me. Ladies and gentlemen, it gives me great pleasure and a deep sense of pride to join you tonight at this annual Symposium fundraiser dinner. Allow me to begin by commending this noble organization for its unwavering commitment to improving the health and well-being of our people back home in Sierra Leone. As we gather here this evening under the theme, the impact of the diaspora in improving healthcare delivery in Sierra Leone, breaking down barriers to access medical missions and future projects, we are reminded of a profound truth, that development is most sustainable when it is driven by the collective resolve of citizens at home and abroad, united by a shared vision of service to humanity. Speaking of this, I'll just make 4 short points. One is the role of the diaspora in healthcare. The Sierra Leone diaspora continues to play a transformative role in shaping our nation's development landscape. Through professional expertise, philanthropy, and volunteerism, you have become an indispensable partner in rebuilding our health system. Health system that has been broken down through years of neglect and the war. For medical missions providing critical surgeries and specialist care to the shipment of essential medicine and hospital equipment, the contributions of diaspora-led initiatives have saved lives, strengthened health institutions, and rekindled hope across communities. Indeed, Healthcare Sierra Leone USA stands as a shining example of what patriotism and compassion can achieve when combined with professionalism and purpose. 2, breaking down barriers to healthcare access. Despite progress, challenges remain. Distance, poverty, and limited infrastructure continue to hinder access to quality healthcare, especially in rural and underserved communities. The government of Sierra Leone, under the leadership of His Excellency, retired Brigadier Julius Malabio, has taken bold steps to address these barriers. Initiatives such as the free healthcare program for women, children, and vulnerable groups, the National Ambulance Service, and the construction and rehabilitation of district hospitals and community health centers, the transitioning of 18 hospitals and over 260 health facilities to solar energy, and improving sustainable power supply in rural areas are part of a broader vision to ensure that no Sierra Leone is left behind. Moreover, Partnerships with diaspora medical teams have expanded the reach of these programs, bridging service gaps and providing vital training for local health workers. Among the most significant milestones is the rise in universal health coverage index, which increased from 36% to 41%, reflecting broader access to essential healthcare services. Another dramatic improvement is in the reduction in maternal mortality rates, which also underscores the government of Sierra Leone's progress. From 717 deaths per 100,000 live births, the number dropped to 433 and now stands at 354, marking a more than 50% reduction within 3 years. All these have culminated in an increase in health service delivery and the introduction of the mobile clinic service initiative is the icing on the cake. And I'll join, the chairman and others to pay homage to our young lady there, Dr. Yebo Kabo. 3, the link between education and health. It is no gainsay that education remains the foundation upon which our healthcare future is built. The government's flagship free quality education program has not only increased school enrollment, but has also inspired a new generation of nurses, doctors, pharmacists, and biomedical scientists. Through institutions such as the College of Medicine and Allied Health Sciences, the University, and are being equipped with the knowledge and skills needed to strengthen our national health workforce. This is reflected in the significant expansion in the healthcare workforce. More than 5,000 health professionals, including doctors, nurses, and midwives, have been recruited. The number of medical specialists in Sierra Leone has also increased as the country has successfully trained 40 experts in various fields, including pediatrics, obstetrics, surgery, nursing, and pharmacy. These efforts have significantly reduced the nation's dependence on foreign expertise. In this connection, we sincerely appreciate the diaspora's continued support from training exchanges and scholarship funds to equipment donations and mentorship programs, all of which enhance the quality of education and health service delivery back home. All listening to the chairman when he, expanded or when he enumerated the contribution of healthcare Sierra Leone to initiatives such as this through training and mentoring and provision of healthcare services over the years. So back to our compatriots in Sierra Leone. 4, the call to collective action. Healthcare Sierra Leone, USA. Let us also look forward with renewed determination. The future of healthcare in Sierra Leone depends not only on government policies, but also on the establishment of the Julius Maga Pediatric Center of Excellence and the completion of the newly constructed midwifery school in Canada. It goes without saying that every contribution, whether financial or intellectual, strengthens the resilience of our closer to the shared dream of a healthy and prosperous Sierra Leone. On behalf of the government and people of Sierra Leone, I wish to extend a heartfelt appreciation to Healthcare Sierra Leone USA, your vision, your commitment, and patriotism. Your work exemplifies the power of unity in action, the true spirit of service that defines our diaspora community. As a chief patron here tonight, I'm deeply honored to associate myself with this noble cause. Together, let us continue to turn compassion into impact, expertise into progress, and solidarity into lasting change for the people of Sierra Leone. I thank you.